Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an October 26, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. To refresh your memory, the Incident Management Team is comprised of myself, Dubuque County Health Department Director Patrice Lambert, Visiting Nurse Association Director Stacy Killian, and Dubuque County Emergency Management Agency Director Tom Berger, and our Public Information Officer, Randy Gale, and all the staff at each of our organizations adding support. Dubuque County's total case continues to climb, with 502 cases in the last 7 days. On a side note, my October 22nd report noted 341 cases in the past 7 days. Dubuque County easily surpassed over the 5,000 case mark this weekend and now has over 5,200 cases. And our 14-day average positivity rate is over 15%, much higher than the desirable 5% or below rate we want. Last week, I talked about the upcoming influenza season, how you could indeed contract both COVID-19 and influenza this season, and possibly even simultaneously. To once again stress the importance of getting the flu vaccination, remember, people also die from the flu. In fact, in the 2018-19 season, Iowa experienced 89 influenza deaths, and last year there was 103 deaths in Iowa due to influenza. Of course, this does not compare to the number of COVID deaths we've experienced in Iowa since March, which is 1,641. The take-home message, get your flu shot. You might need it this year. I went to the grocery store this past weekend and was rather amazed. I thought we had been doing a good job informing the public about the surge of cases since September, how it's not slowing down, and how Iowa and Dubuque County hospitals have record numbers of COVID patients. The U.S. had a 40% increase in COVID hospitalizations in the last month, along with a total of over 225,000 deaths since March. But that information is not affecting behavior. I see it every day. When we first implemented public health measures back in March and April, we advised only one family member going to retail stores, etc. for necessities, not entire families or couples. Now that we have more cases occurring than ever, I'm seeing mom, dad, and the kids all going to the grocery store together. Why is this a bad thing? Because instead of one possible exposure in the store, you're bringing in four people that could be either carrying the virus unknowingly or with symptoms, and also 4 people instead of 1 that could contract the virus from someone else inside the store. I get that if a family is out together on a Sunday afternoon to get out of the house and then decide to stop at a store, but only one person should go in and everyone else wait outside or in the car. I see this again and again with other measures. We're not utilizing online ordering or curbside pickup as much, and people are also making more trips to retail establishments in places in the community versus fewer combined trips. I don't get it. Regardless of how tired everyone is of hearing about public health mitigation strategies, and regardless of whether you believe the numbers and data from the Iowa Department of Public Health or the Center for Disease Control, the message is the same. We continue to promote face coverings, maintaining physical distancing of at least 6 feet, limiting group gatherings and their size, and performing proper hygiene, sneeze and cough etiquette, and sanitizing to minimize the spread of the virus. The hospital staff continue to ask me to inform everyone that even though those that are hospitalized are not typically the young adult, the vulnerable and elderly are being infected from their community spread, which is causing the increased hospitalizations. Remember, those hospitalization numbers are not the same people from day to day. They account from people going home, deaths, and new admissions. Thanks for tuning in today, and as we start off the week, I'm reminded of an expression from a citizen during a conversation I had answering his COVID questions. He said, "You're fighting a rainstorm, but the windows are all open." You got that right. Let's start over this week. Bring back our actions and decisions the way they were before pandemic fatigue set in, and restart our safe public health measure habits to keep our community safe, because we're all in this together.